Hello, welcome to my channel, our fertility place. Okay, last time I talked about letrozole and what you need to know about letrozole for fertility. In today's video, I will be talking about how you can take or use letrozole. So if you have been prescribed letrozole to treat your infertility or to correct your ovulation disorder, you need to watch this video to the end, because I'm going to be showing you how you can use letrozole to help you get pregnant and to correct your ovulation disorder. You see, letrozole is actually a oral medicine that is, and it is a prescription drug where that is, it is your gynecologist that will prescribe or recommend it for you. So it is prescribed off label to treat female infertility and to induce ovulation. It is called off label because letrozole is not actually produced, it is not originally produced for treating female infertility. It was just found, due to its mechanism of action, it was found effective and safe to be used for treating ovulation problem, and that is why gynecologists recommend it for their patients having issues with ovulating regularly. So, and that is what I will be teaching you in this video. But before I go into today's story, I would like you to subscribe to this channel if you have not, and put on the notification bell so that you can always get to see my new videos. Okay, so stick with me as I go into today's story. So welcome back. Now I want to teach you how to use letrozole for fertility to increase your chances of getting pregnant or to correct your ovulation disorder. So for you to do this, especially if you want to use it for fertility, if you want to use it to get pregnant, your doctor has recommended it for you so that you can increase your chances of getting pregnant. You need to have these two things in place: the drug itself, letrozole. It comes in 2.5 milligram, and then your ovulation kit. This ovulation kit is like a strip that will help you to monitor if you are ovulating or you are not ovulating. So you need to have these two things in place: your drug and letrozole, and then your prediction kit, that is ovulation kit, to know if you are ovulating or you are not after using this drug. So like I said, letrozole is an oral medication. It's a tablet that comes in 2.5 milligram. So it is used one tablet daily from the second day of your menstrual cycle. So your menstrual cycle starts when you first of all start seeing bleeding, when you start seeing your menstrual period. When you start seeing your period is your first day, and then the second day when you see your period is the second day, and that is the day you start using this drug. So you can use letrozole at any time. You can use it whether in the morning, in the afternoon, or in the night. But you need to make sure that if you take morning, you need to stick with it for the rest of the 5 days, because it's going to go through, you are going to be taking it for a course of 5 days. So when you start your medication the second day of your period, you use it when you start it, maybe you take it 1 p.m. that in the first day. The second day is going to be 1 p.m. The third day 1 p.m. You need to stick to the time. You can use it whether with food or without food, it doesn't matter, but the most important thing is that you are taking it the second day of your period at the same time, 1 p.m. daily for 5 days. And then after the 5 days, you start using your ovulation strip to start detecting whether you are ovulating or you are not ovulating. You need to, how you are going to use that ovulation strip is, after from the 6th day, you are going to take your urine and then dip the stick into the urine and see if it comes with two the control color and then the test color. If it comes with 2 marks, that means you have ovulated, but if it comes with just the control mark, you have not ovulated. So you need to do this daily so that you will know whether you have ovulated or you have not ovulated. And it's not just that you are going to be doing, you need to start having sexual intercourse with your husband. Okay, you need to start having sexual intercourse, because you need to start doing it before, during and after your ovulating. So it's not that day that you ovulated that you are going to start having your sexual intercourse. From before, you every other day you need to start, because it's going to be a timed, you are going to be during that fertile period, you need to be having sexual intercourse every other day with your husband for you to increase your chances of getting pregnant. So probably you ovulated but you did not get pregnant the first cycle, you need to repeat the course again the next cycle, and this is going to be with the permission of yourself, your gynecologist and your partner. Okay, you don't decide that by yourself. Your gynecologist, you need to take your gynecologist along and tell him about your results. Okay, so he's going to tell you how many cycles you need to go for it, especially when you ovulate and you were not able to get pregnant. But ideally, you are supposed to try it for 6 cycles to avoid hyperstimulation of your eggs. Okay, so but after the trying for the 6 cycles, you need to go back to your gynecologist to review your fertility treatment options. Okay, probably you have other condition that is also that you're also having apart from ovulation disorder. Okay, but if it is just the ovulation disorder and your husband too is fine, you should get pregnant with letrozole during that period, especially if it helps you to ovulate. Okay, so like I said, for you to increase your chances of getting pregnant with letrozole, you need to have the drug in hand, 2.5 milligram letrozole and your ovulation test kit, so that you can monitor if you have ovulated or you have not ovulated. Then you time your sexual intercourse with your husband and then you watch and see if you are going to be successful, if you are going to get pregnant with it. So hopefully you are going to get pregnant with it, and then you'll be able to carry your dream baby. So if you like this video, please subscribe to this channel and put on your notification bell so that you can always get to see my new videos. I will be sharing more tips and more fertility treatment options that you may want to discuss with your gynecologist to help you get pregnant. Thank you for watching. See you.